So this week I've come across a couple of different scenarios where people were wondering if I have a medical issue, past procedure in my abdomen area. Maybe it's in vitro fertilization, maybe it's a colostomy bag, maybe I just had my appendix out, maybe I just had a tummy tuck, right? No matter what it is it something that, can I go see a chiropractor as I'm healing and recovering from the procedure? And the basic answer is yes. I'm Dr. Joe Utash, Wellness Key Chiropractic, just trying to answer some of the common questions we see on a regular basis here from our patients and from people who are curious about chiropractic. So I have an opportunity, I'll be speaking with the ostomy group here in Tucson here shortly, and I just wanted to create a video for them as well as for other people who maybe, again, they're going through IVF, in vitro fertilization, and we're sensitive in this area, and I totally understand. So here's what we do in this particular case. So if it's a person with a colostomy bag, certainly I don't want to do anything that's going to put a tremendous amount of pressure on their abdomen. So when they're, while a normal patient would go face down on the table, and I might do adjustments through their pelvis, their low back, using the table and the drop pieces, obviously that would not be the case when it comes to a person with a bag here, right? And so we would actually have that patient start face up. And so I've had this before in the past where it was a temporary bag in this particular case, but for a couple of months while she was wearing that bag, we actually had the patient start face up, and I was still able to adjust her pelvis with the drop tables face up, and there was no issue whatsoever. Of course, my goal as a chiropractor is to remove stress off the central nervous system using the spine as kind of levers and buttons, right? And so we can do that when you're face up with different adjustments. Certainly, I prefer even to adjust the neck or the cervical spine when you're face up. And then for the people who are particularly sensitive, maybe you just had a surgery or whatnot, I can get very, very specific with, this is called an arthrostim. And so, again, subluxation, which is stress on the nervous system, is caused from two main things. One, misalignment of the spine, and then also fixation. And so this is a great device, a great tool to break up some of those fixations and those subluxations to, again, take the stress off the nervous system to allow the body to heal itself. Again, I certainly don't claim to heal anybody when it comes to any of these issues, but ultimately their body can perform better, it can heal faster when there's less stress on the nervous system, and that's our goal, whether it be with a tool, with my hands, or with the table. For those with even a more sensitive approach, we can use what's called an activator. So it's a little tiny piece of equipment that delivers a very specific thrust. Again, using those levers and buttons, that is the spine, right, to take some stress off the spinal cord and off those nerves. This allowing the patient to have some great relief on the nervous system, whether it be from pain or just really functioning, recovering, and sleeping better. So again, simple answer: can a person with a colostomy bag or a bag of any type, maybe they've just had a recent abdominal surgery, can we adjust that patient? Of course, the answer is yes. If I need to stay away from the entire, lumbar, thoracic region, I can certainly do that. And you still get the most bang for your buck kind of working from the neck up as far as proprioceptive and neurological input. But there's lots of different options that we can do here at our office, Wellness Key Chiropractic, to take some stress off the nervous system to aid in the recovery of that patient. I hope this helps.